Well, is Alzheimer's actually a form of diabetes? We're here with Dr. Emily Cooper from the Diabetes Research Foundation, author of Metabolic Storm.
Thanks so much for being here.
Thanks for having me.
Some people are calling Alzheimer's type 3 diabetes.
It's true because we hear about memory problems, dementia, Alzheimer's disease, and some of us do worry about whether we're affected and what we can do to prevent the future risk. But scientists have found that people with abnormally low blood sugar, such as hypoglycemia, or abnormally high blood sugar, such as in prediabetes or diabetes, may be particularly vulnerable. So they came up with this term, type 3 diabetes, to kind of explain that connection.
I mean, you wouldn't normally think dementia would be linked to diabetes. Has this been talked about for some time?
Well, this is what's so interesting, is that glucose is the primary fuel of our body, and our brain relies on glucose especially because 90% of the fuel the brain uses is glucose. So if there's a glucose shortage, such as in hypoglycemia, low blood sugar, or there's a glucose utilization problem, you can develop brain impairment and cognitive problems. Exactly. And so, this is a real concern because now they're seeing that people with diabetes in midlife have a 77% higher risk of dementia.
Wow.
And then, as we've talked about before, people aren't always screened. So nearly half our population, our adult population, does suffer from prediabetes or type 2 diabetes, and yet most of the people don't know they have it. For example, 90% of people with prediabetes are undiagnosed. A third of people with type 2 diabetes are undiagnosed. So if they're not being screened, they're not being treated, and we wonder what that does for our future risk for these dementia problems.
So if Alzheimer's and dementia may somehow be linked to diabetes, how does that change the way doctors treat it?
That's a great question because so far the treatment's not changing yet, but we have 15 years of data now from researchers that are showing that common diabetes medications that are also now being used in obesity also seem to be able to prevent the progression of this cognitive impairment and maybe even reverse it. So now we've got human studies underway, and the results so far are very promising, and they're correlating with what has been seen in the animal studies. So hopefully someday we're going to find out that just simple treatment with these types of medications that we commonly use for diabetes may really reduce our risk.
So that's on the doctor's side, but on the patient side, then you have more avenues to explore now. You basically, if you've got a history of dementia or diabetes, then you probably really should
be screened. Be screened for prediabetes, be screened for diabetes, and have a dialogue with your provider to find out, is there a more aggressive treatment I should really undertake to reduce my risk not only of the complications of diabetes, but also potentially future dementia-related problems.
Wow. Okay. Definitely gives us something to talk about, think about. Dr. Cooper, as always, great information. Thank you so much.
Thank you so much for having me.
Thank you.